Hi, everyone, and welcome to Canceling COVID. I've got one light that's off, and that's all my fault. I'll take care of that in just a moment. I'm Tonya Rivens, and thank you so much for taking the time to join in and watch Canceling COVID, a place for real talk and real solutions to stay safe in the middle of the COVID-19 pandemic. And we've been with you every week now since January, and we're so grateful for your support, grateful for you tuning in, grateful for our sponsors, Groundwater Solutions, as well as Mecklenburg County Public Health, metcountync.gov, who is also a great sponsor of the show. 980-314-9400. If you have any questions, they are there available to assist and for you. Right now, it's a race against time to get more Americans vaccinated before the Delta variant becomes dominant in the country. That variant is the highly deadly and contagious one that swept through India and is now dominating in the UK. Excuse me. Dr. Fauci, the director of the National Institute of Allergy and Infectious Disease, he warns America can't afford to let the same thing happen here. And boy, did we see that. It was such a sad thing to watch, seeing them having to literally burn bodies out in the street. So that's really tough to even say as I articulate that and think about the visual of that. We don't want to get there, folks. So the same thing may happen here according to Dr. Fauci. And he's warning that if we aren't, or if you aren't vaccinated, do so and do it now. Not a whole lot of time for you as far as this headed our way. And of course, we see what happens in Europe. It tends to head this way. So it's not like we don't have a forewarning. So our question of the day, we're asking, how concerned are you about variants like Delta? Jump into the chat and tell us what you think. We'd love to hear your thoughts. And I just want to add one other thing as well. You know, it's our community that's kind of lagging behind in getting these vaccines or getting vaccinated. And the concern is that this variant will be one of the reasons that we'll kind of have a setback. So keep all of that in mind as you weigh in your thoughts and your decision on what you plan on doing. Now, our health leaders warn more people need to get vaccinated, and there's a push in the community to empower people of color to take control of their overall health. We talked about this, and it's important. Take control of your health to improve your chances of surviving COVID. And one thing about what has happened with COVID is at least it's given people an opportunity to start evaluating how they're taking care of their health care. Now, the CDC found that roughly 33% of people who've been hospitalized for COVID-19 were African American, yet we only make up 13% of the US population. Now, what's also troubling is that African Americans account for 34% of COVID deaths, and it all points back to underlying health conditions like obesity, diabetes, and high blood pressure, things that are prevalent in our community. It gives me great honor, though, to bring on our first guest, Hannah Hicks. She's from the Park Community Development Corporation, and she's joining us. I'm honored to welcome her in. She is a health and nutrition expert who works with the Park Community Development Corporation and Side Real Branding. And you're doing some great work. I'm hearing great things off the bat. You have a commitment, genuine interest, and I know that you are very hard at work to address some of those issues. So good afternoon, and thank you so much for taking the time to join us.
Yes, thank you for having me.
Absolutely. So hopefully you can hear me okay. I'm gonna turn my volume up some. Yours came a little low, but hopefully we'll get it adjusted here. But what I'd like to start with, Hannah, is what do you consider the worst dietary offenders that put minorities at risk for underlying health conditions? And while you're answering that, I'm gonna adjust my lighting. So again, what do you consider the worst that put minorities at risk for underlying health conditions?
Yeah, absolutely. If I'm being completely honest, I kind of don't love to look at foods necessarily as like offensive or bad. I tend to kind of look at it more that foods, some have just a higher nutritional quality, some have lower. But that being said, it is kind of hard to dispute this idea that nutrients don't have a correlation to certain health conditions, because they obviously do. So things like saturated fat, cholesterol, and some simple sugars tend to be the ones that I focus on in terms of things we should reduce, and finding ways to replace them with things that are higher in health promoting nutrients like protein and fiber.
And when you mentioned sugar, that is like my biggest curse. It's so difficult. And really, as someone that's been down south all my life, I mean, my family just swears by sugar. You know, even my mom at 85, you know, it's so addictive. And I'm talking about the white sugar, you know, adding it to everything, whether it's collard greens, I mean, you name it, not just for desserts. And sugar seems to be a real problem for many of us.
Absolutely.
Well, what should be the first focus when we start the journey to clean up our diet? Basically, where do we start? Because no one can just go cold turkey. I know I can't just walk away from sugar.
Yeah, it's definitely very difficult to find ways to kind of adapt your way of eating, especially if you've been eating that way your entire life.
Hmm.
But I tend to try and look at it kind of more of finding ways that we can add things into our diet that are a lot more health promoting rather than focusing solely on things that we have to take away. So I like to focus on, adding more whole grains, adding more fruits and vegetables, finding ways to incorporate new lean proteins and making sure we're getting enough water. It's a lot more optimistic. It helps people kind of get back on the track of that rather than being like, oh, I can't have my chocolate anymore,
Right. So, Hannah, when you say that, because I've heard people say you can eat as much as you want and eat, and I don't mean to the extreme, as
Mhm.
long as you flush it out with water. Is that a valid statement?
I probably wouldn't say that necessarily water flushes it out. Water is definitely an incredibly important thing to make sure we're getting enough of, and people probably don't often get enough water. But in terms of, you can eat whatever you want and it's going to flush out by water, I would say no, that's a bit of a myth.
Oh man, I hate to hear that because that's what I've been trying to like. Okay, I'll eat all the chocolate I want as long as I increase my water intake. But certainly, I know you're not taking away from the value of, drinking more water and staying
Absolutely.
dehydrated or
Hmm.
staying hydrated. Correct?
No, absolutely not.
Well, for those people already worried about the food that they have to give up, and there are a lot of us, what are some smart substitutions that you can make without sacrificing maybe the taste?
Yeah, so I tend to look at substitutions kind of as like a we need to pick our battles type deal. So, for example, let's say we want to increase our whole grains. If you hate brown rice and you love white rice, all the power to you, eat your white rice.
Yeah.
But it's all about finding things that you do enjoy in terms of the substitutions. So, for example, my family at home, we've kind of made the switch to eating vegetarian at home. It's
Hmm.
something that feels comfortable, it's something that we enjoy, and it's a way that we can really incorporate that lean protein into our diet without stripping away the flavor. Other things that I've done, I don't drink soda anymore. I drink mainly like seltzer water, so that kind of gives me the same essence to it. And then adding fruits to your nightly dessert, that's another way of thinking about things. I like to do that with, I have ice cream every night, and adding fruit, while not necessarily a substitution, does still add in some of those micronutrients that we might not be getting otherwise.
And I've learned from baking pies, especially when you're doing fruit pies, if you use less sugar and add ice cream, then that kind of helps offset it some. I'm not saying one is better than the other, but that's a trick that I've heard and been taught by my aunts. They swear by that. So that's interesting to know. Now, so many of us miss the mark with water consumption. What health risks are we opening ourselves up to by not drinking enough water?
So, like I was saying earlier, water is like probably one of the most important nutrients you can physically get. Your entire body is made up of 75% water, so it's very essential. Generally speaking, when you don't drink enough water, you'll notice some of the early signs of just kind of getting like a mild headache. Sometimes you feel a little bit run down. But when people really start to get severely dehydrated, I mean, you can get to pretty severe fatigue, brain fog. It's hard to think. It's hard to do much of anything. Your skin will be worse, and if you do it prolonged, it can really reduce kidney function, which is not good for you.
No, it's not. And those are quite a few problems. But we've heard what is the proper water intake? Because for once, one time I think it was like eight. And the question, what is the recommended amount? I've heard that it's eight, I guess 8 ounce glasses or something
Mhm.
like that. And then it's like half of your weight. What is it? It's very confusing.
It is, and it's a little bit difficult because a lot of different leading bodies will give different ways of calculating the kind of right amount of water. The eight ounce glasses is definitely one that was thrown around, and it's kind of an arbitrary number that people chose just to have something that was tangible to be able to see.
Hmm.
But generally speaking, the dietetic community will tell you about zero point 0.5 to 1 ounce per pound. So some say you weigh 150 pounds, it'll be about 75 ounces to 150 ounces, which correlates to like 9 to 18 cups of water a day.
Well, some people just go all in and just do 1 gallon a day. The
Mhm.
challenge is having to run to the restroom and getting your body accustomed to it. And maybe I'm doing something wrong because I've increased my intake and I've been doing it now for probably a year. And it doesn't slow down the running back and forth to the bathroom. And I guess the
Mhm.
best part is it is, for lack of a better word, I guess, flushing my system out. Now that you kind of killed my theory of eat all the chocolate you want, but it's still it does help to, I think it does help my skin and it does help
Mhm.
with my system and drinking the
Absolutely.
water. Yeah. So, with that in mind, also, one way the Park Community Development Corporation helps the community make is what you do is you help the community make better health and wellness choices through the Cooking Matters program. So let's talk about that a little bit. How does that work?
Yeah, so Cooking Matters is a program that focuses on teaching low income families how to cook and eat healthy on a budget. There's a particular emphasis on families that have very young children, so between the ages of 0 and 5, and children who are special needs. Normally, participants can enroll, like non-COVID times, in a 6-week in-person kind of interactive class where they'll do nutrition focused lectures, and then you get to do hands-on experience in the kitchen. In addition to, normally they do a grocery store tour where you go around, you get to kind of learn how to read all the food labels and how the grocery store works. But with COVID, the program has been somewhat adapted to be more online. But the Park CDC will be offering online, in person, and some hybrid programs moving forward. They're adapting the system a little bit.
Let
Um,
me say, I love that. Not to cut you off, and
no,
I
you're good.
absolutely love, love, love that. And I think about when my son was young, and I got him in one of those young chef cooking classes to try to at least get him exposed to proper eating and interest in the kitchen. And then they kind of closed it down. And I was just by one in Cornelius yesterday,
Mhm.
and it's opened back up, and there were a lot of young kids out there. And so you're offering something that our community needs exposure to and possibly can't afford it. The Park CDC is offering it for free. So kudos to you all. I really love that. What kind of reception are you getting from the community with this?
It's pretty good. I mean, it's a nationwide program, so it's shown all over the world, or all over the world, all over the country. I don't know what I
Yeah.
said. And yeah, it gets pretty good reception. I love the kids classes probably the most. It's really fun to be able to watch kids tangibly get to see the things that they're cooking, especially if you're at the grocery store. They can kind of help pick the things out, and it's a really cool process to see people go from the start of their meal all the way to the end and realize that they are the ones that made it.
And what's also really cool is you are addressing the need when they are very young. I just had someone that was having a conversation. In order to change a lot of things that we need to change in this country, you've got to get them when they're really young. So
Mhm.
again, I really love that, appreciate that. And you said that you guys have had to kind of have a hybrid remote model, but do you expect for it to go back to in person? Did you say that real soon?
Ideally, we would be going back to in person soon. It's looking more so like it's probably going to be some hybrid type deals where we do like nutrition stuff online, and then maybe have people come in if they're comfortable to do in person cooking classes. That's the hope.
So I'm talking with Hannah Hicks. She's with the Park CDC, providing some great information. Don't forget our question of the day, though, which is really important, which is this variant that's threatening to head our way. That's a known fact headed our way. Are you really concerned about it? I see you hopping on. I really would love to read your comments. So hop in the chat and share your thoughts. How concerned are you about the COVID-19 variant? Even if you've gotten vaccinated, some concern for those that have not gotten it, because we all are living in this world together. And speaking of that, Hannah, one of the things that we constantly talk about is how COVID-19 just ripped off the whole covers on the health disparities and health that's happening with our community. So I really appreciate the work that you're doing in addressing how we can be healthier, a healthier lifestyle, and of course, eating better and addressing our nutrition. Of course, beyond that, we know there are other layers, for example, the food deserts and issues like that. But we're grateful that you are taking the time and working with the CDC to kind of expose and make suggestions, coming with solutions. So, with that said, any closing thoughts or anything else that you would like to add?
Yeah, so I mean, I know that a lot of people, when they hear about the word diet, it kind of has this negative connotation, like we're all here to strip things away. And I really just want people to know that eating healthfully and eating in a way that makes you feel good does not need to be awful. It does not need to be you taking away all of the things that you love, and that it's really just about finding a balance between your mental and physical health in terms of the way you're eating.
Do you have a challenge when people are say to you, I don't do diets, I don't like diets, and you're looking at them and you're kind of thinking, well, you might want to address your overweight or your weight issue because it leads to so many other health problems. How difficult is that to kind of let people know there is a connection?
It can be really hard because weight is such a stigmatized thing, and people have
Mhm.
a really hard time feeling good about themselves. And so it's no fun to, hear like, oh yeah, you might need to lose some weight, and finding ways that do that in a way that doesn't make you just miserable, because
Right.
you don't want to be physically miserable and mentally miserable all at the same time. So it can definitely be a tricky obstacle to speak with people about that kind of thing.
Well, it takes a special gift and a special individual to be able to do that. So we certainly appreciate you, Hannah Hicks. How can people get in touch, or if they want to find out additional information?
So people can go to theparkcdc.org for more information on our programs as well as Cooking Matters. So reach out there if you have any questions.
Absolutely. Hannah Hicks again, the Park CDC, also works with Side Real Branding. We're so grateful for you and Kevin Hirams for all that you're doing to help our community. Thank you so much for taking the time to talk with us. As we continue, guys, again, I see you hopping on. Hop in the chat, share your comments. Thank you to Hannah, too. We talk about everything. So real talk, real solutions, and that's a real talk right there. We've got to address some things that are happening with us as far as our health. It's really important. It all ties in together. If there was never a wake-up call, then we have gotten one now. I mean, like the bullhorn telling us that we've got to do better about addressing our health and disparities. And we've got to be honest with ourselves first. And one of those is addressing obesity, diabetes, high blood pressure, and all the things that come along with it. I'm looking for your comments. I'd love to put them and share them with everyone. Hop in the chat. Of course, we're talking about canceling COVID, and a big part of that now is in our community, we're lagging behind with the vaccine and the variant that just pretty much crippled India. Dr. Fauci says it's headed our way and we must get prepared. So less than a month until the 4th of July, and President Biden's goal is to administer one vaccine shot to 70% of adults. It may fall short. And that's kind of disheartening, discouraging, because everyone's worked really hard. So far, 53% of American adults right now are fully vaccinated. A little under 64% have received one dose, according to the CDC. Now, she joins us every Wednesday. Groundwater Solutions, a huge sponsor of the show, and we're grateful for her support and a partnership. Bringing in our guest. Well, this is home for her. We're talking about Dr. Tracia Black of Groundwater Solutions. We're going to talk about some of these numbers. So, Dr. Black, it's always good to see you and always great to talk with you. See, boy, time sure does
Same here.
Yeah. And thank you again to Hannah. She talked about some of the issues that we've already been talking about, is addressing some of our health issues. So, you
and it's things we've heard about hundreds and hundreds of times, and nobody pulls the trigger on taking action. It's time for action. And I think hearing that is very important again. And we're just planting seeds, and it's got to take root, and it's got to blossom in our community and our lives.
I wish we could take that cooking
How are you?
Replicated
Right
around
there. Have a good evening.
the city, not just in one location. Would be really great. I see you're out, so let me.
I am. I'm out in rural North Carolina, and I have not a great signal, and there's lots of activity around me, but we're going to get through this.
So let me quit talking and move on. So let's start with the question of the day. Now, how concerned are you about COVID, the variant like Delta and others making their way to the U.S.?
I am very concerned about those variants. And Tonya, I have to be honest, I'm concerned about the variants for those who are unvaccinated, but I'm also concerned for those who are vaccinated, because I think health is really the key. I got a call this morning from a patient who had been vaccinated, received both doses of their vaccine. I think the second dose was in April. And she had been around someone earlier in the month, I think around the 1st of June, who was COVID positive, just found out a couple of days ago that she had been exposed to COVID. She says, do I need to be concerned? And I said, I think you need to be tested. And she was tested, and she was positive for COVID-19. And that was just today. And
did she have
was she having any symptoms?
Right.
She does not have any symptoms at this time. So that was a great thing. I think in that way, the vaccine is probably protecting her. Not sure about any of her underlying health conditions, but at the same time, she took the responsible step and got tested so that she cannot spread it to anybody else. So now she's going to be at home quarantine. The things that kind of we backed away from, those basic things that we've done since the pandemic, really flared up in the United States. We did lots of things to keep ourselves safe. We've got to keep doing those things with all the variants that are coming in with the existing strands of COVID-19. We've got to continue doing that regimen.
And it's disheartening kind of to hear that, because we work so hard, and that's what we said. We work really hard, and I wish that we would continue to do more education, just educate, testing, and vaccination, so that people will realize that we're not out of the woods yet. So right now, the U.S. is reporting the lowest average of daily COVID-19 infections and deaths since May 2020. But even with that, would you say that millions are still vulnerable? Would you put it at millions still vulnerable to being exposed?
I think absolutely millions are still vulnerable to being exposed because COVID is out there. It's still there. The variants are coming in. So as long as it's in the community, it is an airborne virus, then we are still susceptible to infection.
You know, this conversation is really tough, because I had a really deep conversation this past week, actually 2 days ago, around COVID and the vaccine and precautions, and, you know, whether, you know, if it's your time, it's your time. All of this that people put out there as far as an argument. And again, that's why I'm grateful for you and Mecklenburg County Public Health. They're here to answer questions and talk about, you know, maybe that little bedside manner of just taking a kid's glove to approach and talk with people, and just kind of explain to them, which takes resources and just takes time to get involved. So in Mecklenburg County, nearly 44% is fully vaccinated, about 49% partially vaccinated, so almost 50%. But how are you noticing the demand for shots change from week to week?
I don't know that the demand has changed in the last several weeks from the organizations that I'm connected with. It's still very slow. I think I mentioned last week that, you know, at the height of when vaccines were first coming out, we were seeing sites like Brownwater Solutions or some of our partner organizations doing 100 vaccinations a day. Wow. And we're down to anywhere between 5 to 10. On a good day, it's 12 vaccinations. So the demand, and it's been pretty consistent, I'd say, in those numbers, still maybe on the lower end over the last week in that 5 to 10 range. But you know, I think education is still key. We need to keep having conversations. One of my staff members told me yesterday about they were out at one of the shelter program off of Nations Ford Road, and they were offering vaccinations. And there was a gentleman, an older gentleman, about 72 years old, sitting on one of the stairs at the facility. And he said, you know, he just went over and sat down and started talking to him, and asked him how long he'd been in the facility, what were the things that he struggled with. He asked if he was taking the vaccine, and he said, well, you know, I don't know if that's a good idea. I don't know if I need to do that. And, you know, just talking, my staff member took the time to educate the pros of taking the vaccines. He addressed the concerns that the gentleman had, and the gentleman got up and got in line to get the vaccine. And he even said, no, you don't have to stand in line. I got your place right there. Come on, sit back down. And when it's your turn, we'll get you over here to take the vaccine. So it's personable services. It's caring. You know, I think that showed that there was someone who cared about that gentleman, and he mattered, who took the time to talk to him. And that's the kind of things that we've got to do in our community to really start that dialogue and to increase the awareness, increase safety actions, whether folks do select to take the vaccine, if that's the step. And again, if we're going to be real with ourselves and we're not going to take those health steps that Hannah talked about, we need to be vaccinated. We need to, because there are no other options for safety.
Well, President Biden, I almost slipped and said Obama, but President Biden, you know, the whole plan of barbershops and hair salons, and that's more of a more personable approach, isn't it? Do you think that will help a lot?
I think that's one avenue. And I think we need to take those strategies, because that's somebody who looked like us that thought of that strategy. And so that's where we need to be with those folks who are, again, boots on the ground at the grassroots level, who already have connections in those communities to be at the forefront of leading this effort.
So, Dr. Black, the whole issue of what Hannah was talking about and, eating better and addressing some of our health issues, wouldn't some of the money or be better invested from this American Rescue Plan of making sure in these desert areas, these food deserts, putting stores and healthier alternatives? I mean, I haven't heard a lot about that. Do you know if that's a part of the plan?
Well, I think it's a piece of the plan, and I'm actually in Henderson, North Carolina right now. I'm with our one of our partners, Grow Green Rural Redevelopment Organization, and they are farmers, and we're having conversations about agricultural programs that we can bring to more rural communities as well as to urban communities, because their philosophy is that the food is the medicine, and so if we can start bringing healthier options, and their foods are organic during the times the past year where we it did COVID testing events. They've been partnering with us to get out healthy food options, and so we need more of that. And I think again, if the funding will follow the meaningful programs for our community with the folks who already are doing it, who have those connections, I think we're going to see better health outcomes all the way around. And that's a shift. It's a paradigm shift in this country that has to happen so that we're not still throwing money in the same old ways to the same old organizations or suspects. Not that they don't have great causes, but are they effectively reaching our community?
And as you were saying that, I just thought about when I commented to Hannah and I talked about my addiction to sugar, and so is my mom. But I always remind myself too, I didn't grow up on the food that my mom has grown up on, all her life, from working on the farm to eating other things that didn't have a lot of what we have in our food that I've been exposed to. So naturally, she's been able to live a lot longer at this point, thank God. But that's another thing that I think we don't think about, the food that we're taking in now versus what our elders were able to, what they had to settle for.
Exactly. And now a lot of what we purchase, even in the stores, if we're not careful, it's poison to our body. The food can either be medicine or it can be poison. And that's why we have so many health disparities, because a lot of the foods that we are eating are poison.
So, Dr. Black, you said you're in Henderson, North Carolina today, or did you say Hendersonville?
Henderson. I've made that mistake too. I thought I was booking a hotel in Henderson, and I booked it in Hendersonville.
Yeah.
But I'm in Henderson. So we're here today. We are at University Adult Care at Charlotte, North Carolina, and we are always at our office at 5104 Reagan Drive in Charlotte, North Carolina.
Groundwater-solutions.org, 704-596-0505. Dr. Tracy Black, certainly appreciate you. As we wrap up, you were able to hang in there. Anything else? Is there anything else you would like to add?
No, just enjoyed talking to you. And I met your cousin yesterday. I don't know if he's had a chance to tell you.
No.
Tommy Nichols.
Yeah, Tommy is kicking off his film festival.
Exactly. And he says he has a project for us. So.
Oh, well, that's good to hear. We're all ears and ready to roll. So good stuff. Thank you, Dr. Black. And you're always working in the community. So thank you for all that you do as well.
Okay, thank you.
All right. Anybody else? We'd love to share your comments. Some great conversation. Maybe you don't want to talk about changing your diet. I know it's tough, but we're talking about the variant that's threatening our country, that's headed from India. And boy, did we see all of the images that are horrifying. We do not want to go back there, folks. So let me cover a couple of other headlines. More doctors say they're seeing a spike in colds and other respiratory illnesses as more states lift mask mandates. I've already talked about that. It was so nice this winter not having to deal with stuffing noses and the things that come along with normally we deal with in the winter months. And help is on the way for parents who need childcare while they're getting vaccinated. KinderCare is offering free services at the W.T. Harris location, Idlewild, and Matthew. So 3 locations for you. Also, Bright Horizons, the Learning Group, and some YMCA locations. They're providing free child care for you as well. And this is why you go and get vaccinated. And I think they're also allowing some time for recovery in case, you need some additional time. But, that's some great help for you. That's a great relief so that you're not having to worry about child care. Now, you'll have to call or go to the daycare center, go to the website and sign up for the slot or call to get the information. Boy, it's been great. Time sure does fly when you're having fun. Thank you again to Hannah Hicks, the Park CDC. She is working with them as well as Kevin Hiram's side, Real Branding, which is really great stuff as well. And then, of course, Dr. Tracia Black out and about in the community doing what they've always been doing since the pandemic hit, which is educating our community, testing, and providing vaccines. Hopefully, you've heard something that will help you or move you to continue to get involved. Take charge of your health issues and do what it takes to try to address so that we can all continue to work together to cancel COVID. Thank you to our sponsors again, Met County Public Health, metcountync.gov, a great opportunity for you to get information from them. As always, life's challenges make you better, not bitter. Thank you so much for tuning in. Enjoy the rest of your day and keep in mind, we're going to cancel COVID. Take care, everyone.